Welcome to the Mayor's Show. As always, I always say we have important announcements to make, but today it's National Awareness for Stroke Month, so it's very important. We've done these shows before. It's very important that you be aware of it, and we're going to give you a dissertation on how you can be aware of it and what to look for. And it's an honor to have Dr. Gooch with us today. Doctor, welcome to our show.
Thank you very much for having me.
I know you're going to give us a lot of information and give the folks out there opportunities to learn about it. And to my left is Dr. Wydro, who's head of ER at Jefferson Torresdale, as Dr. Gooch is also down at Jefferson Torresdale.
Correct, yes.
So we'll be talking about that and the great work that they do. Just to give you a quick one, I had COVID and I was down there a couple of times and they took great care of me. So it was great to get through it. So we made it through it in flying colors, and I appreciate all the doctors that you do at Torresdale. They do a great job. Doctor, I'm going to start with you. Now I'm going to make sure you're assistant professor of neurological surgery at Torresdale. Is that correct?
At Jefferson University, yes. Within the Department of Neurosurgery. Yeah. And I basically, what we've done since late August is we opened up a mechanical thrombectomy program at Torresdale.
Explain what that is.
Sure. So for patients who are suffering a stroke, for many patients who have what we call a large vessel occlusion, so a blockage of one of the major arteries in either the brain or the neck, we can, the first thing is to get to the emergency room because you may be a candidate for TPA, which is the clot busting agent. However, in some instances, what we will do is actually do a procedure to go up within the arteries of the body to open up that artery, either suck out the clot or drag out the clot. Sometimes we have to put a stent into the artery or multiple stents in order to restore blood flow to the brain. So we now have the ability to do that at Jefferson Northeast at the Torresdale campus, and that represents a big investment on the part of Jefferson and a part of the hospital in money, but also in personnel, and specifically in putting one of these suites in, which is it's a fancy radiology suite, essentially, that enables us to do these procedures there. And we've been doing them since late October.
So this is kind of new at Jefferson Torresdale to do the whole procedure there?
Yes,
because you have new equipment, I understand?
Correct. So prior to us opening this facility within the Torresdale campus, those patients, either Bucks or Frankfurt or Torresdale, would be sent down to Center City. And we would do the procedure down there, which is fine. However, there is going to be some delay in transporting the patient. So by being able to do the procedure closer to where the patients are, then we can get better outcomes and kind of get to the patient sooner.
Yeah, and certainly something here that we've been partners in, Dr. Wydro, is the ambulatory that we have here that Jeff has.
The mobile stroke unit.
The mobile stroke unit has put here in Bensalem, and that has been super successful. You might want to touch on that.
Sure. So Mr. Mayor, first, thanks for giving us a chance to talk about this. As you said, May is Stroke Awareness Month. And what we are really trying to get out to the general public is that stroke is a medical emergency. Sometimes people don't remember that, and they think that stroke is something that is, once it happens, it's done. But what we're here to tell you, and I think we want people to be aware of, and Dr. Gooch is here to really trumpet, is this is a treatable disease. What does that mean? Well, if you're having signs or symptoms of a stroke, which I think we'll talk about as we talk a little bit more, you should call 911. You should not sit at home. You should not think about it. You should call 911. It is always better to get evaluated. The 911 system, the dispatcher will quickly make an assessment. If they think you're having a stroke, they'll dispatch an ambulance, obviously immediately, and they're going to then do an assessment to bring you to the proper hospital, to a stroke center or thrombectomy capable hospital. The Bensalem Mobile Stroke Unit is a partnership between Bensalem EMS, Bensalem Township, and Jefferson Health. Yep. And that is something, it's certainly in this region, one of a kind. There's only very few across the entire country. And what that allows is you bring not only the emergency department, but you bring the CAT scan and you bring the clot busting drug and the neurologist to the patient's house. So we talk about curb to needle time. So we used to talk about door to needle. That was getting to the hospital to getting a needle of medication. It's now curb, when the ambulance pulls up in front of the patient's house until the needle gets administered. And that's because they've been seen by a neurologist and gotten a CAT scan, which is unbelievable.
Yeah, while we're on that subject, and certainly Tom Topley's out here watching as we do this, some of the stats that we've had, calls a day 529
Yes.
for that ambulance
Yes.
to respond, and treated and transported was 254. That's incredible numbers that, I'm not going to say I know how many would not make it, but this certainly is an incredible stat. And we're going to have a young lady on here in a few minutes to talk about that actually survived.
Stroke survivor story.
Yes.
Well, Mr. Mayor, it's important that what that tells you is that stroke is very common. 800,000 strokes happen in this country every year. People don't realize how common of a disease it is, and it's one of the leading causes of disability for people as well. And I think what this program demonstrates is partnerships. You're all about partnership. This is not only Bensalem Township and Bensalem EMS. We're working with Middletown Township and Pendle Middletown Emergency Squad, working with Bucks County Rescue Squad and Bristol Township. This is really communities working together to provide excellent stroke care.
Well, you never heard me speak, but every time I give a speak, and Tom knows, is teams win.
Yes.
Nobody can do it. We have to have a team together to do that. I just want to remind everybody, they got this. It should be on your fridge or somebody. These are the steps you can look for that if you think you're having a stroke. And Jeff has provided them for us, and we send them to every house. Doctor, I hope it helps, because I know it's on my fridge. Please, we went through a lot of trouble, and Jeff went through a lot to make sure that people understand what the symptoms are. So, and you said 911 right away, right? Don't play games with it. Doctor, you're down there now, and you're obviously doing what Doctor did down to Jeff that was on our show. We had Doctor here, was the head of
Dr. Rosenwasser
that was on there, and I'm sure you worked with him at some point in time.
Absolutely.
Because I always thought he was the best. I always thought he was the best, but now I got you here.
Don't tell him you said that.
But anyway, tell us about some of the symptoms and the technology that you have. We talked about the ambulatory and that things, but how about, can you give anybody any ideas what they should look for besides what we're talking about here?
Yeah, I mean, the other thing to bring up, I guess, is that sometimes people have wake-up strokes. So they go to bed normal, and then they wake up and they don't feel normal, or they're weak on one side of the body, or they fall out of bed as opposed to just getting out of bed. So that's the same thing. I mean, you need to call 911, and it's an absolute rush to get the person to the hospital to get them evaluated. I will say that this is it's very intuitive that opening up the vessel can quickly can improve outcomes and get people better. It's really over the last few years that we've gotten better at both the three different things. Basically, we've gotten better at the system, this is an example of it, the system of getting the patients to the appropriate hospitals in time. We've gotten better at the procedure as far as being able to open up the vessels. I mean, just the technology of the devices we use are, I've been in practice for 4 years, and the devices we use now we didn't have when I was in training, because they're just getting better and better and better every year. And then the other thing is our imaging has gotten a lot better. So we're better able to appropriately pick the patients who need these procedures, and so there's been significant advances on every front, and that's why we're doing the show now today. I mean, this is what it kind of leads to. And then the other thing is that in patients who still, despite our best efforts, patients still go on to have significant strokes. That can still happen, of course. And that's really the next thing, which is in the future, which is more rehab, and also better technologies that are not yet out, but they're being worked on to help improve function after a person's had a stroke.
Did you notice anything different, either one, doctors, on COVID than last year? Was there any significant, do you think, change in it? Did it have anything to do with it?
Yeah, actually, Dr. Gooch's department at Jefferson did a lot of good work around that.
Yeah, so actually I got one of my partners is the director of vascular neurosurgery at Jefferson, Dr. Pascal Jabor. has really done a good job kind of sounding the horn, so to speak, in that we found that a lot of patients who had COVID came in with strokes, and generally these were younger people, and the strokes were worse, meaning that it was harder to get the vessels open. A lot of times we go up, we open up the vessel, the case is done. In a lot of COVID patients, we were finding that we would open up the vessel would reocclude. Now it wasn't every single patient who had COVID was having a stroke, far from it. But there is this aspect of COVID which we still don't completely understand, that in some people leads to a hypercoagulable state or some sort of cascade that leads to some patients having strokes.
Yeah.
So we've seen that with COVID.
Boy, I'm lucky. When I think of all these symptoms and things that could have happened, my goodness
No question.
gracious. Well, I'm going to give you your last word here to talk about whatever you like to, Doctor. I'm going to bring Daria on.
Okay.
And so tell us what you...
So as you said, Mr. Mayor, I mean, this is an opportunity to educate the community once again about stroke and stroke awareness. So, our message is simple, is that stroke is a disease that has modifiable risks to it: smoking, your blood pressure, your blood sugar, if you're diabetic, but also that has to be recognized early, and the symptoms can be very subtle. It could be a change in vision or blindness, sudden blindness. It could be dizziness, a change in speech. Most people know about if their face becomes paralyzed or arm or leg, but the symptoms can be subtle, and that BFAST magnet you're speaking of is really what we want people to be aware of. And it's a medical emergency, and if you're having the signs or symptoms of a stroke, call 911. And we will bring the resources to you to bring you to the right hospital to make sure that you can get the care that you need to avoid the long-term disability that can happen if a stroke is so devastating to a patient. And the message that we want for Bensalem Township and all communities is that stroke is a real medical emergency. Don't waste time. Time is of the essence. Time is brain.
Right. I want to thank you, Doctor, so
Thank you,
much.
Mr. Mayor.
And
always good to see you.
Good to see you, and we see you a lot, and thank you for all you do.
Thank you.
For our community. I mean that sincerely.
Thank you, Mr. Mayor. I appreciate the
Okay,
time.
and we'll be talking to Daria now.
Yes.
Well, to my left, I have Daria.
Hi.
Daria Canale, is it?
Canale, yes.
Canale. Daria is a survivor, a stroke survivor, and a nurse, I understand.
Nurse practitioner.
A nurse practitioner. So, gosh, that's kind of a combination there, Doctor, to be able to be a nurse and God forbid, have that happen. You're a survivor.
That is true.
So, tell us about it. Tell us all about. Well, first, tell us what you do. You're a nurse practitioner.
I actually work for Dr. Wydro in the emergency room over at Torresdale. So
Okay.
I've been there for a couple of years.
Is he a good guy?
He is a good guy. He is a good guy. So what would you like to know?
Well, I want to know about. First of all, you're a nurse practitioner.
Yes.
You guys do very, very hard work.
We do.
Sometimes I hear they do more than a doctor. People tell me.
I agree with you 100%.
No, I'm totally kidding you now.
I'm not.
But I hear, because you do have a very tough job.
We do. It's enjoyable. It's
But
enjoyable.
tell
We
us
help a lot
what
of
you do.
people.
Tell us what you do.
I work
there.
in the emergency room over at Torresdale, do a lot of rapid care and fast care type of patients, sort of in and out, trying to expedite, the throughput in the emergency room.
Okay, and now tell us about your stroke.
So I had a stroke back in November. I was had a carotid dissection, and then I was on blood thinners, and then I moved my furniture, and I guess one of the blood clots moved, and then my face was classic droop. My arm felt funny. I almost fell down my stairs, and we called 911, and the cavalry and the mobile stroke unit came to my house.
Stroke unit.
Yes,
Okay.
yes.
And they did tell us what they do.
So they pulled up in my driveway while they were getting me, I guess, together on a stretcher. They were leveling the truck to make sure it was okay. Literally moments. I had a CAT scan. Within moments, Dr. Gooch's face pops down on this
That's
TV.
something we forgot to say. Yes, in
Yes.
the ambulance, the doctor
in
really
real time.
come up.
Yeah, so
In
it's a
real time.
telemedicine thing, yeah. So we come up on a screen and we're able to see them, they're able to see us, and that's how we evaluate the patients.
Do you understand what they're saying? When Daria went in to the CAT scan,
In my driveway.
And then the neurologist or neurosurgeon is able to evaluate them at that moment, yeah.
In real time.
So
Yeah.
were you able to see that?
Yeah,
The
yeah.
screen? You
Absolutely.
watched it? I've been in there, not as a patient, but just.
No, in real time. Laying down, like, do this, answer this, talk about this, in real time.
And
Like being in the office or in the hospital.
so what did they do?
I got a CAT scan in my driveway. I did not have a bleed. They Dr. Gooch recommended being sent to Jefferson, Maine, because we didn't have his services at Torresdale yet. Went down via helicopter to Maine campus, and he took a clot out and put a couple stents in my head.
Oh my God, God bless you. You got lots of work to do. The good Lord's giving you
You're right
lots
about
of
that.
time.
You're right about that.
Yeah. So what do you recommend now? You know what the symptoms were, and what do you...
I can only kind of dovetail off of what Dr. Wydro was saying. At the end of the day, you know, you have the cards out. You know, if there's something wrong, call 911. Call 911 immediately. The dispatcher will figure out if you need to have the stroke truck sent to your house. But I mean, when something's wrong, that's what they're there for.
Wow. So we're grateful that you
I'm
made
very
it through
grateful.
like you did. And we're grateful that Jeff allowed us to have that ambulance here that works in our community and some surrounding communities. And that wasn't cheap, that ambulance. They cost them a lot of money to put into our community. So we're so grateful for that.
But think about
and
the
Tom
lives it saves.
Topley has certainly used it to, you know, he's the best. We have the best EMS team of any community. I mean that sincerely. And we really do. And we're innovative and the best equipment. We try to do everything the best. And Tom Topley is our executive director. He does a great job doing that. So I really appreciate being here.
Thank you.
And we're blessed that you made it through this. And
That we are.
and we're going to bring our executive director, Topley, on
Perfect.
now. Okay?
Perfect. Perfect.
And I want to thank you so much.
Of course. Thank you.
Daria. Well, Tom Topley has joined us, our executive director of our Bensalem EMS. Tom, welcome aboard, brother.
Thanks for having me
Good to
on
see
there.
you. I see Tom a lot. With the great work that you do, Tom. And obviously we have Dr. Gooch over here that's leading the way and has told us a lot so far, what's going on. Maybe you could talk a little bit about implementation and how our guys are working down there and using the ambulance, the stroke ambulance.
Well, like you said earlier, and you always say, teams are win. Our team actually, we have a paramedic and a EMT on the mobile stroke unit, and Jefferson actually supplies a nurse and a radiology tech who runs the CAT scan. So that team goes out to your house, and we can do a lot of things in a very short period of time. And we know that with stroke, time is brain. We learned years ago with heart attacks, time is heart muscle, and now we're learning that time is brain tissue in strokes. So we can go out and provide you a CAT scan. Our average time from the time we get to your house to the time we start the CAT scan is 9 minutes, which is outstanding. You can't probably do that in a hospital that quickly. Right after the CAT scan, then we do a teleconference with a neurophysician from Jefferson, like Dr. Gooch. And these world-class physicians from Jefferson Center City are assessing our patients right in back of the ambulance in their driveway. And they determine whether they need the clot-busting drug TPA, or they need a rapid transfer to a thrombectomy lab where a doc can go in with a catheter and remove a clot from your brain and help restore your functions.
Let me hold you up a second. Doctor, when that happens, and obviously you guys call the hospital to get them online for the TV?
Yes.
So you'll call and you or someone else will come on?
Yeah, we actually get a heads up that the ambulance is going. So if the 911 call comes in and there's a suspicion of a stroke, then the mobile stroke unit goes, and then they actually send whoever's on call gets a text message like, hey, we're going to evaluate a patient. So you have a call, you're expecting a phone call within the next few minutes.
Okay, so
and then
you're
they
ready.
call you. Yeah, so there's all there's multiple, the lines of communication are open. So then, you're ready. So then you get another phone call like, hey, we're with the patient. We're getting the scan right now. And then within a few minutes, we log in. And then by the time the scan is done, we read it usually right away. Also, we get a call from a radiologist who has read it as well and says, like, there's bleed, there's no bleed, that sort of thing. And then that's how the decision is made whether or not to give TPA, the clot-busting agent. Then once that's done, we make that decision, and then we also, obviously the person's going to go to the hospital regardless, but the question is which hospital, and if there is concern for a stroke, then they'll get further imaging once they get to the hospital. But the ball is rolling, and the ER is expecting the patient at the time.
That's what I was going to say. The ER is probably ready too.
Yeah. Oh yeah.
They're coming, no matter what. They're coming to the hospital.
Yeah.
I'm sorry, I didn't want to interrupt you, but
No, it's great. It's a giant team effort. people don't realize how many different things come together to make our program work and to treat victims of stroke in Bensalem and our surrounding communities. But by the time our ambulance is done treating the patient, they've been registered at the hospital, they had their initial CAT scan done, they've been given drugs either to control their blood pressure or help bust up the clot. A neuroscience physician, which is probably the hugest part of the program, has seen the patient's assigned to a physician, radiology's read their films, and they're registered at the hospital. So by the time we get them to the ER, the first hour plus of work is done, and they move right on to the next step. And before Jefferson Northeast opened their lab where they can remove these clots with surgery, we also actually worked with a helicopter service from Jefferson, and we would take the person
Daria. That's what Daria did.
We would take the person to the local Jefferson hospital, and a helicopter would automatically be dispatched and in the air before we got there, just to speed up. We've actually saved people hours of time before brain surgery. At
Well,
points.
and saved their life.
Yes.
In a lot of cases, yeah. Doctor, I'm going to give you the last word. Anything you want to say, anything at all out there?
Yeah, I mean, I think that, I reiterate everything we've talked about as far as a low threshold for calling 911 to get evaluated. The other thing, I mean, obviously, as you can see from Daria, like, she's not old, so it can happen in younger patients.
Yeah, very young.
For sure. So, but that would be the main message, I think. It's just low threshold for calling 911 or getting your loved one to the hospital to be evaluated.
Well,
and maybe you'll be wrong and they'll be fine, and then
Yeah,
and
I'd
they're
rather
fine.
be wrong.
Yeah, rather,
Yeah.
yeah, exactly.
Well, I want to thank you,
Okay.
Doctor.
Thank you, Mr.
very,
Mayor, for
very,
having me. It was
very
a
much.
pleasure.
Yeah, hope to see you again here on a show, not at the hospital.
Absolutely.
And Tom, as always, the great job you do here in Bensalem. We appreciate it very, very much. And to our other guest who was here, Dr. Wydro, that's still sitting in the studio, and Daria, who went through the whole process and sitting here, a beautiful young lady today, and her life was saved. So till next time, everybody, God bless.